I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh, it's amazing.
Join co-hosts Jamie Rocci and Teresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone. Hello, and welcome to the Hormone Genius podcast. I am here with my awesome co-host, Jamie, to do a fun Q&A on a topic that we haven't talked about before. I guess we did talk about it a little bit in a previous podcast, but we're going to take a deep dive into male infertility because we know a lot of our listeners out there are interested in fertility in general. And so obviously, when we talk about fertility, it takes two people to form a new human being. So we cannot leave out the very important aspect of the male in the partnership of making human beings. So we're going to deep dive into male infertility. Couple of caveats. I am a women's health nurse practitioner. I treat women. I do not in general treat men. So I'm not a urologist. And so my level of expertise will be fairly kind of basic. But I do treat men in the sense that I very much care about my females having a man that has really quality and healthy sperm. So this is an important topic to me, because I have to, think about male infertility quite a bit. So Jamie is going to be asking, a lot of questions. Obviously, she'll have her own knowledge about things too, but this is going to be a fun Q&A.
Yes, I'm so excited for this, Teresa, because it is true. It's almost like, when we're working with women who struggle with their fertility, when it comes to the male infertility aspect, it's sometimes hard to come up with good solutions. And, I think what our listeners are going to really want to learn today is thinking about like high level lifestyle, like what can men be doing to just help the quality of their sperm in general. And then also what may be male infertility factors that could be checked if they haven't gone that route yet. So that's kind of how I would like to start, Teresa. It's kind of thinking more about like high level health aspects. So I'll start there. Teresa, does a man's health affect the quality of his sperm? Does it affect the count of the sperm? Like, what does health affect when it comes to male fertility?
Yeah, absolutely. I think kind of it seems common sense, and it is common sense that if your body in general is struggling with any disease, your sperm are going to be affected by that. Mm-hmm. So that could be heart disease, it could be diabetes, it could be high blood pressure, it could be just obesity. All of these things that create inflammation in the body, these diseases that create inflammation will affect sperm. And, an interesting kind of stat we could start out with, Jamie, just to really put this in perspective, because we know that there's been a lot of increase in obesity, heart disease, diabetes, autoimmune disease in the last 50 years. Well, if you look at sperm counts in relationship to that, so there was a big study that came out probably in the last year, maybe a little more, that looked at the decline of sperm counts since 1973. And it is clear that we have in our male population, and this is around the world, 50 to 60% less sperm by count per mil than we did in 1973. Mm-hmm. So you might say, like, if you're a man born today, you will have 50 to 60% less sperm than your grandfather did. And that is fairly shocking, I think, because in the period of evolutionary time, 50 to 100 years is not that much, right? Mm-hmm. So the question is, of course, why is this all occurring? And, there's speculation about, some of these diseases and obesity being related to it, but also then, is this related to the environment and what we've introduced into the environment in the last 50 to 100 years as well? But in any respect, I think for like I have 6 sons, I think this topic should be kind of at the forefront of all of our minds. Mm-hmm. Because if we want to have our sons, our daughters be able to have their own children, we have to be thinking about the health of their sperm, maybe at younger and younger years, So I'm looking at my, 15, 16-year-old son and learning about male infertility. And I'm thinking, gosh, I should really care about the health of his sperm now, so that when he goes on in his 20s and 30s and he's married and wants to have kids, he will be able to do that. It's really important to people.
Yeah. Do you think that the reason, I guess I'm generally speaking, I'm assuming because of the world I grew up in my like little sphere. But it seems like no one really talks about sperm health hardly until there's a problem. The same is true, I say, for women's health, but less so, because every month, we're cycling, we have a period, we have a reminder. There's a physical reminder of our cyclical nature as women. And so for men, I think that it's just a less talked about thing. Wouldn't you say that's true?
Oh, I think it's 100% true. And I think part of and I think every woman who is in a relationship with a man kind of knows that talking about health and even going to a healthcare provider can be a challenge for a man. Mm-hmm. There's probably lots of reasons for that. Mm-hmm. So if it's hard for me to get my partner, spouse to go to a doctor to get checked out just for the general things, right? It's hard for them to go talk about something even more intimate, right? Like their sperm and the health of their sperm. I mean, there's a sense of pride around your ability to be able to be fertile. And I think it's a fear that, I see it when I have a couple in front of me and I'm talking to not just the woman, but the man too. Mm-hmm. Could it be a factor for you that this is contributing to the aspect of your, you as a couple not being able to achieve pregnancy? Right. And you can see, that causes a fear, but also just kind of like, wow, a sense of like, this might be my body. And I think women are kind of more used to that. And we're kind of swept up into the healthcare system, I think, earlier. Mm-hmm. So, yeah, I do think it's different. The good news is I think it is changing a little bit. I think more men are willing to talk about this. I think that the actual scope of male infertility is growing in terms of interest, in terms of research, in terms of training urologists and doctors to actually do a better job addressing these issues. So I think there is, just like in women's healthcare, hopefully down the road, there'll just be better care, better treatments.
Right. And when you think about it too, I mean, when, a woman ovulates, she's releasing an egg or two, one of hundreds of thousands, depending on how old she is. But when a man, when he releases his sperm, when he ejaculates, there's millions. And so one might then think, well, okay, so we think about the health of that egg because there's one of them, as compared to millions of sperm. So someone might be thinking, what's the big deal, Teresa? I mean, 50 to 60% less, like there are millions of sperm to work with. So like, how would you respond to people having that thought?
Yeah. So the first thing I think of is that, there's this idea that it only takes one sperm. Mm-hmm. And you're right. I mean, it is fairly incredible when you think about the fact that a man in his lifetime will produce 500 billion sperm. I mean, you're just like, I have a hard time like wrapping my brain around that. And then like when you talk about, you're making, and you look at different sources, you're going to hear anything from men make 3 million to upwards 100 million of sperm a day. And that, of course, is independent to the man. However, when we're talking about it from a fertility perspective, and when a man ejaculates into a woman, mm-hmm. The amount of sperm that actually are going to make the race. So in some ways they talk about like the reason why you need millions is because of like this huge competition to get to the one egg. But it's only by the time those sperm are at the point where they're reaching what we call the oviduct, or so the fallopian tube, there's really either hundreds to maybe 1,000. Again, these are just kind of general kind of thoughts about how many actually make it there. So you may deposit millions of sperm into the vagina and only have 500 to 1,000 that actually make it up into the fallopian tube. And at that point, and this is what's so cool about the kind of the chemistry and complementarity of the two bodies working together, is that, the vagina is very acidic by nature. And once semen is introduced into the vagina, immediately the vagina will change its pH by 2 degrees. And the semen, once it's in the vagina, actually then goes through its own chemical change, and it becomes a more gel-like substance. And it almost like freezes almost the sperm for a small amount of time. And then it releases them again by another chemical process so that the sperm can kind of unite with the cervical mucus. In fact, if you read about this, the sperm, like once it reaches the cervical mucus, kind of like these two liquids meeting together, the sperm almost have to like dig in and make a channel. And we know that in cervical mucus, Jamie, we learned about estrogen type mucus and how it has these channels, like almost like fern-like channels. And these sperm literally almost like make, like they are like ants marching. Once they find the channel, they all line up and start going through it. And, again, the mucus itself, another kind of incredible aspect of this is that it is meant to filter out the sperm that are not normal. So there's all of these biochemical processes occurring that frankly are just freaking amazing, and complicated. And I think, when you look at a semen analysis, if you take a man's semen analysis, what you realize is that you have millions of sperm, but you only have a certain amount of effective sperm. So we call that like the effective sperm count. So I have a sperm count of 10 million, but only 40% of those are motile, progressively motile, and only 5% of them are normal. So when you take that 10 million and take the third of them being motile, and then only another, 5% of them being effectively normal in terms of their look and make, it's not a lot of sperm in the end. So you got to have a lot to get to that effectiveness.
Yeah, that's a great answer. Like that answered my question really well. Okay, ladies, this is incredible. It's so cool. So what Teresa just said is there are swimming channels, kind of like these, like I think literally of like a lap pool. And I think about sperm traveling through this lap pool. But like Teresa said, the columns are just the right size. Again, these are columns or these ferns within our cervical mucus. So let's say the head of the sperm is too big, or it's a 2-headed sperm, or there's something weird, like Teresa was saying, there, if there's any malformation, then that's one way to like kick them to the side. I also learned once that there are different types of sperm, like there's fighter sperm, there's blockers, there's egg getters. And it's so funny because, these sperm have like different roles. So it's true. And so that's just a really good point. Okay. Super cool, Teresa. All right. So now that we kind of learned about, how sperm travel, how our body works in harmony with one another, now let's start digging into numbers. I know you said nowadays it's 50 to 60% less, like in terms of the sperm count. And we talked about some environmental things, maybe some obesity, sort of lifestyle things. But what are some like just things that men need to be aware of unknowingly that might be affecting their sperm count that maybe like is self-inflicted? They're just not aware.
Big picture of male infertility, like there's, just like with women, there could be structural problems, and those right off the bat would have to be addressed, like as a urologist. So I just want to say that because the lifestyle things are its own thing. But if a man has, issues with his count and motility, the first thing he needs to do is go to a urologist and look for the problem, right? And that could be a structural problem, which the most common, it's well over 30% of men with infertility will have something called a varicocele. And a varicocele is like, it's this pouch, they call it a bag of worms, which is just kind of disgusting, but it's like, I liken it to like varicose veins in women. It's basically the blood flow is getting kind of complicated, or compromised is a better word. And so you're not able to move the blood through the scrotum appropriately, and you're getting these veins that are engorged. And so that's going to prevent proper sperm production. Well, varicoceles can be repaired. So, if you have a sperm problem, you should be checked for that. You should be checked for an obstruction, which is less common, but should be checked for. The other thing you need to be checked for is hormonal problems. So just like a woman who has, we think of this thing called premature ovarian failure, and we test that by testing her pituitary hormones. Men can have testicular failure, very common, and not very common, but actually uncommon, but it would be easy to test for. So you want to rule out these kind of bigger things that I think, need to be addressed at a different level. And then if we've ruled out all those other things, and again, seeing a proper urologist is always a good idea, or at least starting with your primary care doctor. And just so you know, in terms of infertility, and now we're at about 1 in 6, 1 in 7, maybe for couples who will struggle with infertility, 20% will have male factor as the primary issue, and 30% will have female factor as the primary issue. Combined, it kind of comes like 50% that it's possible that you'll have a male factor at least involved. So that's a lot. So we're talking half of couples, we need to really be focused on male factor. And so again, seeing a urologist, you're going to need that semen analysis. And the semen analysis, of course, it was developed, we use standards by the World Health Organization. And they're looking at count, motility, agglutination, turbidity, color, liquefaction, white blood cells, and morphology. That test can be done, and it's very easy to do. Now, Jamie, people, they wonder about doing that test, and we have a special way that we do in our office. So if this interests people, because I think this is important to a lot of people, we have couples collect their semen analysis in an active intercourse. Whereas you can see, obviously, an ejaculation can occur by an active masturbation. But a lot of couples feel that it would be better for them in terms of what their standards are, their beliefs are, to collect it in active intercourse. So we really do that as a standard. And there are kits that you can order to do this. And if you need more information about that, reach out to Jamie and I. We can give you that information. But these tests are very easy to run. They're very cost effective. So in my laboratory, it costs $60. We don't even run it for insurance. And that gives you a really good idea of the count and motility.
Yeah, no, that's incredible.
Yeah. And do you have any questions about any of that? That I know we're moving on to the lifestyle, but I really wanted to get those kind of big picture things.
No, I think it's important for women to know, because again, in our line of work, we're working with women, and it's almost like the male fertility is the stone that hasn't been turned yet. So again, as our listeners are listening to this, the first step is to go to the doctor, have a urine analysis. And if you are uncomfortable, of course, like with how the semen is collected, reach out to our email, or you can even check Pope Paul VI Institute. I'm sure they have information on how to do that, but it does not require masturbation to, again, get the sperm count, because it's through an active intercourse. So that's great news. So that's a really good first place to start. Varicocele vein is very common, as you said, and then you talked about like the brain connection. Okay, so we talk about all that. I also wanted to say too, because the reproductive organs of men are located outside of their body, their testes are outside their body. It needs to be at a certain space. There needs to be a certain, I'd say, like distance, I suppose, from the physical body. If it's too close to the body heat can be so warm that it can kill off the sperm. Same thing, like if men are in a hot tub, like that's a fact, right, Teresa? Like if men are in a hot tub, it can kill off the sperm. And so you want to make sure that the temperature is okay. Because of course our organs are inside our body. We don't need to worry about temperature control, but on the men's, of course, different. It's a different story. So I wanted to make sure I shared that too, in terms of something that you might not be considering. But if you have a hot tub and you're in the hot tub every night, that could be causing some issue.
Yeah, no, the heat thing is a very primary kind of thing. And, this got into the argument about briefs or boxers, whether or not that actually was enough to hold the testicles close to the body. Because again, the testes they're dropped down in front of the body to create a temperature that's at least 2 degrees less than what the normal body temperature is. And the testicles will move up and down based on temperature. So, but yeah, you put a laptop on your genitals and you sit there for hours with a laptop, that's a lot of heat going right to your testes. If you If you're sitting in a hot tub, constantly saunas, another thing would be saunas. If you're a big sauna person, anytime you're going to expose the testicles to a lot of heat and biking, even like cyclists who bike for long periods of time, because they're not only wearing really tight biker shorts, but they're also compressing their testicles against the body as well. All of those things have to be considered if you are trying to conceive, right? And then the last one would be cell phones, and there definitely is enough data to say that you should not put your cell phone next to your genitals. And that can be from the standpoint of the heat, the battery, but we don't even know what the long-term implications of electromagnetic, irradiation is at those low level amounts. So you just don't put them there, so everybody who's used to putting that cell phone in their front pocket, again, you plan on having babies, probably need to put it in the back pocket somewhere else. So that's just really important to remember. Other lifestyle factors, would be medications and drugs. So let's talk about recreational drugs. I mean, you definitely, if you want to conceive, you definitely don't want to smoke, but not just not smoke cigarettes. You definitely don't want to smoke marijuana either. So these are, again, research has proven that those things do decrease, like your ability to have not just a normal count of sperm, but quality sperm. Again, we want quality sperm to make healthy children. So you don't want to smoke, you don't want to drink excess alcohol at all. And of course, medications that you take and ingest for like a particular disease could affect fertility. And I can't go through all of them, but some of them might be some of the antipsychotics, even some antibiotics that are a little bit more rare. So if you have any concerns about medications that you're on, you really want to talk to your doctor about that as well. And the last one, and this is the most important, this is like PSA announcement, the whole point of this podcast, because it's happened to me enough and I get frustrated with it. It may make sense to you that having low testosterone would be a problem for making sperm. And you would be correct in knowing that low testosterone, because testosterone is what produces sperm from the Leydig cells in the testes. However, giving exogenous testosterone to a man will not increase his sperm production. And in fact, it will actually do the very opposite. It will almost make him completely infertile. And this has happened enough of my patients' spouses that I get frustrated, because it seems to me that maybe there's some doctors who don't know that, or maybe they're just unaware of the significant impact of exogenous testosterone on fertility. But you cannot give a man testosterone and hope that he would conceive. I don't care if it's an injection. I don't care if it's a cream. If your plan is to conceive, there is another way to help your testosterone. And we could talk about, what those ways are.
Yeah. Let's talk about that. What are some natural tools? This is a question I get a lot. My husband struggles with sperm count. What are some natural ways that we can increase his sperm count? What would be, a few tips that you would give them?
Yeah. So there definitely, if we're going to go full on natural, there's definitely some evidence-based research that would show that certain supplements can help with count and motility and morphology of sperm. So just to kind of like get out the big ones, vitamin C. Vitamin C is, of course, a great antioxidant, and it reduces free radical damage and oxidative stress on the body. So a man could take like 1,000 milligrams of vitamin C daily, maybe even twice daily. And that has been proven to help. The second would be vitamin D. Vitamin D, of course, we talk about a lot in this podcast, but it is considered almost a pre-hormone. It's a fat-soluble vitamin. Of course, sunshine gives it to us, but many people, well over 40% are significantly deficient, and probably 80% are not ideal in the population. So an easy thing every man can do out there is take vitamin D, and a standard daily dose would be like 2,000 IUs, it would be safe for everybody. 2,000 IUs vitamin D3, and that's a pre-hormone. So that helps the body literally make testosterone. And then you've got vitamin E, which is also a fat soluble vitamin and also known to be a great antioxidant. And so vitamin E can be taken probably somewhere between 200 to 400 IUs a day. I kind of prefer, there's some fancier kind of forms of vitamin E called tocotrienols. And so those are good. Then you've got selenium and zinc. Selenium and zinc, and I know you know a lot about these two nutrients, but in particular, like zinc, actually, the highest concentration of zinc in a man is going to be in his testes. And so it's very like important that they have adequate amounts of zinc. And they found that in a population, if you looked at infertility, men with lower zinc levels would be less fertile. So zinc is super important. And, you can get, thankfully, that COVID, a lot of people were taking zinc and vitamin D. So that's kind of been good. But adding 15 to 25 milligrams of zinc a day would be a good one for helping count motility of a man. Thanks. And we've got the selenium too, which actually, did you know, Jamie, that selenium is like a part of the tail of sperm?
No.
Mm-hmm.
I didn't know
so
that.
Like it's almost like it's a protein substance called selenozymes, and you need selenium, and it is a part of the tail of the sperm. So selenium, and they've actually done studies on selenium paired with CoQ10, which the active form of CoQ10 is ubiquinol, and found that also improves count motility. And those are both great antioxidants. So 200 micrograms of selenium, another 200 to 400 milligrams of CoQ10 or ubiquinol, again, the more active form of it, also has been shown. And then we've got L-carnitine. This has been studied in men for count and motility as well. And it's an amino acid and can be taken orally from 1,000 to 1,000 milligrams to 5,000 milligrams a day. It can even be injected. So that's a really important one. And B vitamins, I would put in there, B12 and folate, also really important for DNA, detoxification pathways, but really for that morphology, I would say the B vitamins are really important. And I know I'm probably forgetting one, Jamie. So what am I forgetting?
Well, I'm just thinking about how a lot of what you're sharing is also like when we think about quality eggs, we can kind of just swoop it over to the guys too. Healthy sperm, healthy eggs. So it is true. I mean, obviously both of these, bits of the male and the female are important to stay healthy. So this is all really great advice for both men and women. But like you were saying earlier, Teresa, women tend to be more self-conscious, aware, and we're doing those things. But to keep things simple, like if you're struggling with infertility, you both could be just taking these supplements, good quality supplements.
I had a couple just recently, and when I asked about what the man was taking, he's like, she looked over and he's taken all the things with me.
Yeah.
And they had basically the whole list. And I was like, that is so great. Cause it's beautiful to see that partnership that can occur, the teamwork, aspect. I mean, infertility is such an emotional cross, and to see the teamwork of the man and the woman kind of like, we're doing this together. It's not just the woman that has to take all the vitamins, right? Exactly. And you can get this stuff from food. I mean, you can look up what's high in zinc, what's high in selenium. I'm not saying you have to take it in a supplement, but unfortunately, we just don't have super great food sources for these things. And it is readily available in good quality supplement form as well. Mm-hmm. So I would say the obesity thing, Jamie, is probably a good thing to kind of just talk about. And we talk about nutrition and obesity a lot. And people may ask, well, what kind of a diet should a man follow? And just like women, we don't have a lot of clear evidence about what diets for fertility actually work. But the one that maybe would have the most evidence would be Mediterranean diet. And so you can't really go wrong with a good Mediterranean diet, high in protein, high in really quality fruits and vegetables. But we just have to remember that when a man is obese, what is he carrying in his body, Jamie? What hormone are we toppling a little bit too high on when we're obese as a man?
Yeah, estrogen.
Estrogen, right. So when we have this estrogen component with obesity, and this is true of women too, but for men, what that's going to do is it's going to turn down their production of testosterone. And of course, testosterone, again, is influencing the production of sperm in the testes. So obesity is a big deal. And I think if you just looked at that as the kind of one of the primary reasons why fertility and sperm counts have declined, that would be a big one. We have up to, 80% of the population is overweight. And then we have certainly well over, 30% that are obese. So we've got a big issue there. So that's something anybody can always work on and get help with a good nutritionist, but also exercise. We are just a lot more sedentary than we were 100 years ago. We don't work out on the farm. And So we've got to get our bodies moving. And so there's a certain amount of exercise that's just required. And I think strength training for men to build muscle, right, to build testosterone, endogenously, then that really helps too.
Totally. And we think about too, when you were talking about, men being overweight and estrogen is stored in fat. Again, it's like we forget sometimes the laws of our body. That's not just for women, it's also for men. So even thinking about like toxins and endocrine disruptors and that whole thing is also important for the men. So I just think that's so important. One last thing I want to ask Teresa, this can maybe be a whole other episode in the future, but some things that I have seen that often go kind of swept under the rug because it feels shameful and it feels embarrassing. When the man may have a porn addiction, he may not be able to be with his wife in the way he wants, because of that addiction, and the inability for him to, export and to ejaculate and all that. So that, I would say, that was probably one of the most surprising things I found as a fertility care practitioner. And if women, if you're hearing this and you're like, that's me, that's our marriage, my husband's addicted to porn, we want to have a child, but it's just not, the parts aren't working the way it should because of this problem, I just highly recommend that you both see a counselor. I know it's so hard. That could be, again, a whole other episode, and it's so hard. Yeah. But I just want to say, like, you're not alone. That does happen. It is very hard, and it's a struggle. And Teresa, I don't know how often you see that or what you want to share about that part, but I just wanted to be sure I mentioned it.
Yeah, I think it's something that doesn't probably get shared as much as it actually is in reality occurring. Mm-hmm. It certainly has come up in my practice. And yeah, I mean, more than anything, I don't think most of the time it's going to be an issue in affecting like counts or anything like people worry like, does frequent masturbation cause a problem? Right. But it's more what it really does to the relationship and the intimacy involved there. So yeah, like you said, Jamie, you really have to get some professional help because it is an addiction and it's something that many men have struggled with. And there is help for it. Mm-hmm. But like you said, Jamie, that's kind of a whole nother episode in and of itself. Yeah. But, one thing, going back to the sperm and like taking these supplements and, what I want people to know about sperm production is that, it takes 60 to 75 days for sperm to hit maturity. So, we have these little sperm in the testes developing, and they develop in the seminiferous tubules, and that's in the testes, and then they mature in something called the epididymis gland. And that maturity and production to the point where they're ready to be capable to fertilize takes up to 72 days. So you want to give yourself 3 months to really adequately kind of get these things in your body. So it might be something to think about, like we talk about folic acid in pregnancy, in terms of preconception care. Men should consider preconception care too. And getting these things in their body quality right is a great idea. So just be thinking about that. That's also why sometimes they'll say, you don't have to have intercourse every day to conceive a baby. Your sperm basically, if you have sex every day, it's going to deplete the count just a little bit, not enough usually to be infertile, but you get full restoration of count within 72 hours. So, some people will say, every other day. I mean, most of the time, I think practitioners like me don't want to kind of tell people what to do in terms of that, like to tell them to use the days of quality mucus is really helpful because, of course, the mucus is so important to achieving.
Yeah, totally. No, that's a really, really, really good point. Okay, so for those of you listening who are struggling with this piece, or maybe there's unknown infertility and you're wanting to navigate it, we can suggest visiting fertilitycare.org. There are NAPRO doctors trained. So again, Teresa's trained in NAPRO technology. There are likely many other physicians that do things just like the way we explained it, which is wonderful. I know FemMat Medical Management, maybe the Marquette system, but we know for sure Fertility Care. So fertilitycare.org, if you type in your zip code, you'll be able to see physicians near you who are trained in this form of serving the men as well. So again, the woman, yes, and we always want to work with the woman first because, again, it only takes one sperm. But if you're trying and it's not working, there are doctors who can work with men who are also trained, like Teresa's trained.
And, people like me actually can give medication to men who are struggling with motility and sperm count too. So I just wanted to bring that up. I mean, there's not a lot of medications that we can use, but there are, just like Clomid is used for women to help them ovulate. You can use clomiphene citrate for increasing testosterone production to help with sperm count. So it doesn't always do like a gigantic increase, but even, mild to minimal, moderate increases can be helpful. The other one that's really helpful is HCG. We use HCG in female fertility too. It's an LH analog. It has a longer half-life. And so you can use HCG twice weekly as an injection, and that can help with sperm count. So I've used both those medications in men as well. So, these are things that you can talk to your doctor about and get more information on as well.
Yes.
Yeah. And when we're, Jamie, people might wonder, when we're talking about fertility, Jamie and I look at this from the perspective of two things: natural conception. So you might not hear us talk about like artificial reproductive technologies or in vitro fertilization, because for us, we're in an area where we want to stay in natural conception. That doesn't mean that's not where everybody else is, obviously, but that's why we don't talk about those things. We're trying to get to the root cause of disease to help people with conceiving naturally. So that's just our focus. So just in case you're wondering, why don't they ever talk about that? That's why we're really in the area of kind of like underlying kind of restoring the body for fertility. Yep. So hopefully, I think we touched on, enough stuff today, Jamie, to give people at least a high level overview of male infertility. But, again, talk to your doctor, talk to a good urologist if you have any questions or concerns.
Yeah. All right. Thanks, Teresa. We learned a lot. And again, if you're loving our podcast and you would like to leave us a review, please do that. And we look forward to seeing you at our next episode.
Thanks for listening to the Hormone Genius podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel. So if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.